Good morning, everyone, and welcome to the European Policy Centre. My name is Elizabeth Kuiper. I'm the Associate Director and Head of the Social Europe and Wellbeing Programme, and I'm delighted to see so many people this morning for the presidency briefing, where we're going to look back at the EPSCO Council that took place last Friday, and especially we're going to see what the Czech Presidency has achieved and what the incoming Swedish Presidency will be focusing on. And I think it's needless to say, and especially for those of you from the Brussels community that have been following health for the last couple of years, that COVID, of course, increased the momentum for health at EU level. We now have the European Health Union with several pillars, where still some of the pillars will be coming also next year during the Swedish presidency. We just last week had a celebration of 1 year of HERA, the Health Emergency Rescue Authority. So there's much more on pandemic preparedness, but also the broader consequences of health at EU level. So we're very happy to have this morning with us Martina Brzková and Joakim Svensson from the Czech representation and the Swedish representation, who are going to tell us more about what they have achieved in the case of the Czech presidency and what the Swedish presidency will be focusing on. And again, I already said the EPSCO Council last week was rather packed in light of everything that's going on in health. There was a new approach to cancer screening with new recommendations. There was a discussion about COVID-19 vaccination and council conclusions that were adopted. And also a lot of files that were being dealt with during any other business. And I'm sure that Martina is going to say a bit more about indeed what that meant and what indeed has been achieved during this Czech presidency. So perhaps without further ado, we're going to go to Martina first. I know that she has a presentation, and then I will pass the floor to Joakim. But as you're probably used from us, it will be an interactive exchange where also you will have the time and the opportunity to ask questions about what you feel is important to deal with when it comes to the presidency. For us, this is the last meeting this year of the Coalition for Health, Ethics and Society, supported by Johnson & Johnson. So, of course, we're very keen to see you now at the end of this year, but likewise, we also hope that you will continue following us next year when we will have a lot of new events in the making, also related indeed to the very full and challenging agenda of health at EU level. So Martina, again, very welcome at the European Policy Centre, very happy to have you. And I'll give you the floor to kick off when it comes to what you have achieved in terms of the Czech presidency.
Good morning, everyone, and thank you, Elizabeth, for the invitation and also for giving me the floor. I will now share the screen, and before I start, I would encourage whenever you feel that you would like to ask some additional question or questions, so do not hesitate. And now I hope.
Yeah, we see your screen, Martina. Perhaps, if possible, just put it in
try
mode.
To have just one. Is it better? Yeah. So this is our second presidency since we joined the European Union. First one was in 2009, and the second is here. Of course, with the Brexit, the chronological order changed a little bit, but actually the first presidency was the first half of year, which is longer. The second half is shorter, so then the 7 months are really packed, and so we are now heading towards the end of the pack, beginning of the December, which we usually have the EPSCO Council. So I will start now just to remind with our priorities in health that we picked up. It was oncology. This is something what is a long-term priority for our government and for Ministry of Health, for different ministers of health. Then availability of medicines, which is a topic that as I remember, since I arrived here, every presidency has this topic because it's important, and we experience some certain problems with the access to medicines. And this topic was also for us connected with the negotiations of the revision of the orphan and pediatrics regulations, but as they were postponed, we focused more on the rare diseases and did some non-legislative events and initiatives in this area. And rare diseases were also priority during our previous presidency, so we somehow continued with this topic. We also even have the same experts in the field, so they still remember. Then vaccine, yeah.
To interrupt, but could you perhaps move the slide, because I think you have indeed what you just said on the slide, and we're seeing the first slide. So I think if you go to the second, I think that would be helpful.
Can you see second?
No, we still see the first.
Because then I try again, because I see the second. Okay, sorry for this.
No problem. Yeah, now we see indeed.
Now you see, slide. So I will try to make it big again. Now it's fine.
It's still not in presentation mode, but we see indeed priorities in health. So it's the second slide. So I think
yes,
this is exactly what we need to see.
Yeah. I think I will stay because I have just 4 slides, so I will have to talk more than what's written in on the paper. So the first is oncology, then access to medicine, and the third is vaccination. This is something what we connect in recent years a lot with the COVID vaccines, but we wanted to somehow focus more on the hesitancy in vaccination in general and prepare council conclusions on this. And the fourth topic was global health, which is something what came up in connection with the pandemics as well. And we decided to focus also with the initiative in the council for the pandemic treaty, so that we would like to discuss it, how to engage EU and how to find a joint position of member states with more impact in this field. And it's actually, I said it's in connection with the pandemics, but also it was initiative of the Finnish presidency as the first presidency for this, who actually initiated informal process how to make the coordination more effective in the council in connection with different international fora. Then you can see the important dates for our presidency. We had like the standard timelines. We had one informal and one formal EPSCO Council. The informal was beginning of September in Prague, and the formal was just last Friday here in Brussels. So I hope you can see the third file, the legislative proposals. No.
Not yet.
Okay, then it's strange. So, well, I have to stop and probably do it.
Perhaps indeed, if you do it per slide, then it works like you did last.
Yes. Now you can see.
Yeah. Now we see legislative proposal, so it's the third slide. Thanks.
Okay. So this is the legislative proposal that we were dealing with. The priority file was the EHDS regulation proposal for the regulation, which is politically very sensitive and followed, and we dedicated quite a substantial number of working parties to discuss. We also prepared a compromise proposal and actually went through the text. It's quite a lot of text in general. So just to go through, you have to just dedicate some time and a substantial number of the working parties, but my colleagues managed to do it. And then we have the another regulation. It's the revision of 2 directives who were merged in 2 proposals for the regulation, and it's the SOHO file, so the blood tissues and cells, BTC sometimes we call it. And we started actually this negotiations in September, after the Commission published it in July. Maybe just to complement with the EHDS regulation, our French colleagues of TRIO, from TRIO, they initiated and we continued. So we are already second, but still, as I said, both are actually very big files. So we aim for the progress reports for both. We also had the non-legislative proposals. We had council conclusions on vaccination, and then also for the report on vaccines procurement, which was unexpected, but yeah. You have to do. You have to somehow react to what's on the table. And then we also, what we knew, that the Commission published the Council recommendation on cancer screening. So we dealt with this, and I'm sorry, I have a typo here. The presidency goal was not a progress report, but adoption. And yeah, for both. Also, maybe for this so far, we prepared the compromise text, but both regulations will be dealt further with the Swedish Presidency and colleagues, yeah, Joakim and Andreas. And I will try next. Just to inform you about the conferences that we did and events. I'm not sure if you can see, but I will.
No, I think it's the same. No, now we see, yeah, health events.
Yeah, okay, so I just have to go back, and if I do, okay. Now you can see the health events that we did. The first one was the conference on cancer. It was only conference that didn't take place in Prague, but in second biggest city in Czech, very close to Vienna, in Brno. And it was a 2 days expert conference, and the outcome was the call to action in the field of oncology. The second minister, well, I don't want to say ministerial, but because all of the conferences we presented as expert conferences, but some ministers were present, but it was a presidency conference. It's the presidency conference. We had 3, and then we gave auspices of the Czech presidency to many other events that took place either in the Czech Republic or here in Brussels. So the second presidency conference took place at the end of October, and was dedicated to the area of rare diseases. The outcome was also a call to action, where we still gather the support from the member states. And third conference was on vaccination, a success story, which was the last one, and took place at the end of November in Prague. And the goal was to assess the lessons learned from COVID-19 and to discuss and present also our council conclusions on vaccine hesitancy and deal with the practical issues that every member state has to tackle. Then, as I said, we had many events, and the feedback actually from our perm rep was that the health area was the most frequent the most frequent events that took place in our premises. Some of them also took place in the European Parliament, but we experienced a lot of interest from different associations and medical bodies that wanted to have a dedicated event under the auspices. Probably the most important were the National Pharma Association that discussed the pharma revision and the orphan and pediatric regulations, and also the biosimilars and generics. The politics on the EU level and the cooperation. And then, as you can see, we had many others as well. Maybe, this was very short. Maybe I will just complement and also to come to EPSCO Council and the topics we discussed there. But maybe one more thing. We have here the conference on vaccination, and this very similar conference was organized by the Commission in Luxembourg, lessons learned of COVID, where they presented the health union package, because actually it's coming now towards the legislative end, and will be effective very, very soon. So this is one thing. It's maybe also important information about this, that the cross-border health threat regulation, the MR regulation, and the ECDC and HERA actually are finalized now, and Commission is already taking steps how to start the implementation. Now I can maybe show this slide with the meeting and with the EPSCO Council. As you said, we had packed agenda, even though we had just one political discussion. It was dedicated to vaccination, and then we presented the progress reports for the EHDS file and SOHO files. And we also presented the outcome of the conferences that took place under the Czech Presidency. And during the lunch, the ministers discussed mental health, which is a nice connection with the priority of the Commission. And maybe one more thing I didn't mention at the beginning when I presented you with the priorities, our priorities in health. You can see 4 here, but we start preparing then in the reality of pandemics, and we somehow reacted to that, but we didn't expect in February that we would have to also tackle the Ukrainian crisis. And even though it was more for the national systems to react, and we have to create another IPCR, which is the Council Crisis Coordination platform, where the member states can react very, very quickly. It's under the Kuiper 2, and recently we have a few IPCRs for certain for different areas that we need to follow, and one of them is COVID, and another one was the Ukrainian crisis. And Ukraine influenced our preparations in a way that we somehow consider it our 5th priority, because we didn't know at the time how long it would take, and now we can see it's very long, and what we didn't know what it would bring. We saw just many immigrants coming that needed help, and I'm really happy that we managed to help and still helping. And yeah, I came completely, so it was the mental health at the EPSCO Council, just to come back. And in the afternoon of the last Friday, we discussed the AOB points. There were some, I think, quite interesting points. We discussed the medical device regulation, the pharma package, foreseen pharma package, the clinical trials, then the Swedish colleagues presented the incoming presidency priorities, and I think that's it. Yeah, I don't know if you want me to go deeper into the topics during the EPSCO Council, but please ask me. I can maybe say something, but I don't want to keep the time too long. So
I see indeed, Martina, that we already have the first questions coming in, but I think what will be interesting is that we go first to Joakim and then indeed open the floor, because it's clear indeed from what you say is that you had a very packed agenda during your presidency, and especially indeed, as you said, also due to the fact that due to the Russian invasion in Ukraine, you also dealt with Ukraine as an additional priority. So indeed, people are very keen, I believe, to ask you questions, and I think they may go from the more political questions about also issues to do with health sovereignty, which now seems to be the new, let's say, flagship word that the Commission has coined as well in the context of the global health strategy. I also was very interested in reading stakeholders' opinions as to we need more council meetings, more EPSCO council meetings, because it's true that this presentation that you gave us shows how full the EPSCO council agenda became. So do we need more council meetings perhaps? And I guess that's perhaps something that we might want to discuss with participants. But I propose that we go to Joakim first, because Joakim, the timing of today's presentation is quite timely, because yesterday we had the official presentation of the Swedish Presidency priorities, and we're very keen to learn what that means for the priorities in health. And Martina already alluded to the fact that, of course, the pharma package, the orphan and pediatric diseases, they probably will figure on your agenda, but I'm very keen to give the floor to you to hear more about what you're planning for.
Well, thank you very much, and thank you for having us here. And as you mentioned, the priorities were presented recently yesterday. So I'm happy that we can now sort of go into also a little bit more on what we're planning to do on the health side. And as Martina already mentioned, the agenda is fairly packed. Just to first say a few words on sort of our more overarching priorities, we plan to focus on AMR, antimicrobial resistance, which, as you know, has been a priority from a Swedish perspective for many years, and also continuation from what we also tried to highlight during our previous presidency, and also something that is really also a pandemic ongoing in a way at the same time. So that's something that we will highlight, and we very much hope that we will be able to work with council recommendations focusing on this and that can then also hopefully feature on the June EPSCO Council. So that's one of the priorities. And as Martina also mentioned, pharmaceuticals has been high on the agenda for quite some time, and that is also likely to feature high up on our agenda as well. I mean, we not only the pharma package, but also following up a little bit on questions such as preparedness, innovation, and other topics that also touch on pharmaceuticals and access and our general sort of preparedness to avoid sort of shortages. So that is also likely to feature quite high. And then I mean, when we come to the actual files, it's quite a lot on the table. We have the files that have already started during the previous presidencies, so we will of course continue with the European Health Data Space. And here we hope to be able to work quite intensely on this file, and of course advance as far as possible. But then of course also it's a quite large and complex file, but we will dedicate quite a lot of work to it. We also have the SOHO regulation that has also been started, of course, and there we also take on from where Martina has already taken us, so that we will also keep working with. And then as you might have seen just the other day, the EMA freeze regulation came. So sorry, so that is also something that we hope to be able to advance quite rapidly on in the council. And then, as you might have noticed from the EPSCO Council, we might also have initiatives dealing with the implementations of the medical device regulations. So that is also something that will be on our table. And then further on, we're also expecting the pharma package that will come sometime during Q1. And that is also something that we will then have to address, of course. And apart from the more legislative files, we also have the just recently presented global health strategy, where we also hope to be able to work with council conclusions together with the development side. So it will be a joint effort here. And we also, of course, dealing with the negotiations on the pandemic treaty and the international health regulations. So there's quite a lot to deal with, and as I mentioned, of course, we hope to address the AMR Council recommendations as well. So a lot of files to deal with. Then we're also planning to have a number of events, meetings, and a little bit on what you touched on, the need for more EPSCO councils. We will do our part in that. We have 2 EPSCO councils planned at least. So one that would be preliminary on the 14th of March, and also one on the 13th of June. So 2 formal councils, as well as an informal health ministers meeting the 3rd and 4th of May. And then apart from the ministerial councils, we're also planning a conference on cancer joined with the Commission on the 1st of February. So we will also continue, of course, to work with the cancer plan. And the 6th and 7th of March, we will have a high-level meeting on antimicrobial resistance, as well as in the end of June, we're also planning a conference focusing on life science. So it's a fairly packed agenda this coming 6 months. I think I'll stop there and then definitely for questions. I see our timing is a little bit tight.
Well, many thanks, Joakim, for highlighting us about what we can expect from your incoming presidency. As you say, there will be a lot that you have to deal with as part of the ongoing legislative files and package. But it's very interesting to see that, I think, as was the case during your previous presidency, also AMR features high again. So I think that's a very important point, because again, after all, the AMR is called the silent pandemic. So hopefully we also can implement some of the lessons learned during the COVID-19 pandemic. I see that we have a few questions, but perhaps to kick off the discussion, and also building on what you said, Joakim, about indeed the fact that you will actually have 2 EPSCO councils. these days, and Martina alluded to the fact that health perhaps was even, you know, the most crowded topic during the presidency in the Perm Rep. And we know that ever since the pandemic, the European Commission, DG Santé, has now reorganized themselves and focused much more on One Health to highlight the importance of health as overall part of health for all policies, as some stakeholders say. Is that something that you see reflected in discussions that ministers are having? Is there a discussion about, is health important enough in policy making per se? Do we have enough competences? Because again, sometimes here in Brussels, we are all very much keen to discuss these issues, but is that something that actually has been discussed around the table with ministers?
Is that a question for Martina or for me?
Either way, who of you would like to start?
You want to start, Martina?
Well, you can start. You took the floor first. Don't hesitate.
Okay. Well, I mean, obviously, as you have seen during the last few years, there has been quite a lot of development on the within the area of health. We have taken quite a lot of steps in sort of in various areas in cross-border health threats. If nothing else, there has been a lot done. Just the of course introduction of HERA as a new sort of player has of course also made quite a significant change. And then if that has a bearing on sort of actual competence divisions, maybe not. So I think we are, I mean, as you know, their divisions of competence are quite clear when it comes to the area of health, and I think that's not something that we are looking at exactly changing. But within those, we're of course doing a lot more now than we used to. That's for sure.
Good. I see, because again, Martina, feel free perhaps later on to come back to it if you want, only if you want. But I see that we have a few quite concrete questions for you. So let me kick off, and also for other participants that would like to come in, we have indeed the chat, but also if you want to come in person and take the floor, please, you know how it works. You just flag your willingness to speak, and we were happy to unmute you to ask your question. But let me start with the first question from Professor de Masseneer. As we probably all know, the chair of the Europeans expert panel. And Professor de Masseneer, your question is, did the Czech presidency take advantage of the opinions of the expert panel on health? So Martina, this one is clearly for you.
Yes, yes, thank you. And I also saw that Mr. Messner had to leave. I could see.
Ah, okay. Well then.
Yeah. So he had to leave. So which is pity. And I went quickly through the links that he sent. And yeah, for the vaccination, we actually used all the sources that we had. It's about the joint procurement. Well, it's something, the legal base for joint procurement is the recently revised, we have new regulation for the cross-border health threats, and the base is there, and joint procurement was broadly discussed, and you probably know it was a very sensitive issue for the Commission and it was also for the Parliament, and I think we found some balanced solution, maybe not to please everyone to full extent, but I think it's a compromise that is somehow addressing the current situation. And so to answer to Mr. Yes, we did reflect it, and I'm sorry, I don't see it anymore, but it's probably answered. No.
Yeah,
okay.
I indeed answered it. And of course, happy because we are in touch with Professor de Masseneer. So happy indeed, of course, to relay your answer to him so that he knows indeed.
That I can send it in written if it would be more useful.
Oh, that would be very kind of you. Absolutely. I now have questions to Joakim as well. And I think I bundle them and take them per two. Because Joakim, we have a question on AMR. It's great to see you focus on AMR. And Martin Brzková asked, any idea what will be the scope of the council conclusions? And then a question which is to do with global health. Let me see where I saw that. Yeah, because you mentioned a joint effort for council conclusions on global health. Asked Alina from FIPRA International, could you please detail who will be the relevant parties involved? So again, what will be the focus of your work on AMR and the council conclusions on global health? Who will be involved?
Well, I think that when on AMR, what we're looking forward to is the council recommendations. So that would first have to be the proposal from the Commission. So we're of course looking forward to what they will propose. But on the contents, I think the question, of course, has to go to the Commission. But we are of course also having our own conference where we'll be looking at such things as incentives, how the EU can contribute on the global level, and so on. So we will also work with that. But on the recommendations there, we have to look forward to the Commission proposal, of course. And then you could just remind me on the second question.
The second was about the global health file.
Yes, of course.
And then also an additional question which has to do with global health. The question is from Louise Bankston, will the draft council conclusions contain additional elements? So it's about the additional elements of the council conclusions as well as the stakeholders involved.
Well, the primarily in the sort of the actual work with council conclusions would most likely be the CODER working party as well as the health working party. So that would be the so foreign affairs development as well as of course the health side would be sort of the primarily involved. But then I mean I assume we also will try to work with include also the areas as related as much as possible. And then of course the actual sort of draft of the conclusions have not been presented yet, so I will have to come back to the more contents aspects.
I very much understand, Joakim. I also have a question for Martina, and it's about the SOHO, the cells, tissues and blood file. The question is, was there any progress made with regard to this file during the last meeting of the Working Party on Public Health on the 13th of December? And it's Marek Cortes who asked the question.
Yes. We dedicated in general 5 working parties to this file, and as we had one after the EPSCO Council, it was planned that we would finalize reading of the chapter 1, and we before, because our main focus was on the Article 3, the definitions, and we also prepared the compromise text for that, which was the actually progress report about. And the last meeting last week was on the remaining articles of the chapter 1. It was the article 1, 2, and 3, and I consider what we really wanted to have the first debate on the scope article, because for this file particularly it's very important as it broadens the scope quite substantially. So it was interesting and really helpful to hear from the Commission the thoughts behind the drafting, and also to hear the first comments from the member states.
Thanks a lot, Martina. I now have a question for Joakim about something which has not been included yet, at least in your presidency agenda, because Marek Cortes asked, why has the Swedish Council presidency not prioritized mental health issues despite the growing awareness of the importance of mental health in society? So Joakim, is there anything that you can say to answer this question?
Well, I wouldn't say like that. I mean, of course, we know that it's an important issue. We know that there's initiative coming from the Commission as well. So I would say there is also ongoing contact, so to speak, to see what would be the sort of most fruitful way in the case that we would also do something in this area. So I wouldn't sort of promise anything now, but let's say that there is discussions ongoing also on what's the most suitable way to take this forward.
Well, thanks for that, Joakim, because I see that also there are other questions about mental health. I think participants are interested in the topics. I think that is good for you to flag. Then there is a question about NCDs. So Jacqueline Bowman-Basato from the European Association for Obesity asked if Sweden is starting to prepare for the UNGA NCD high-level meeting in 2025. So that goes even beyond your presidency, Joakim. So I don't know, is this on your agenda?
Well, I'm sure that we are preparing in Stockholm, but of course it's also a little bit more on the WHO track, so not necessarily so much that we would work with directly in Brussels, but obviously, I mean, it's something that would be managed also from our colleagues.
Another question really is I think for the two of you, and I think it's more of a broader question to do with health policy. We have someone asking how the current, so the Czech and the incoming Swedish presidency, use the learnings from COVID. And then, for example, the question refers to rapid cross-collaborative solutions, but also massive economic consequences. And how does this lead to build more resilient healthcare systems? Because in essence, it's now recognized how important resilient systems are for sustainable and equitable care. So I think the question is indeed, given the fact that since the pandemic, we learned so much about the importance of health, both from a planetary perspective, a well-being perspective, socioeconomic perspective. So indeed, is this recognized that basically health is important for a lot of other policy areas? So I don't know who would like to start with kicking off the answer to this question.
Well, I can start because it would be very convenient to have time to actually assess the lessons learned, and we do to a certain extent, of course. But as I said, the Ukrainian crisis somehow hit the systems again, at least in our case, because we provide the healthcare for the immigrants for free in full extent, and so there are additional costs. So, and what's important in those situations, like both crises are huge, that you have to be effective with the money. So we were actually the outcome of the pandemics, or one of the outcomes was that we have EU for Health program with much more financial backup that we ever had before, and we are now trying to use. We have also the reforms that we can use, but to reform the health system is not easy. It's not a quick process. So, and also what we experience also during the pandemics, lack of healthcare workers and medical staff, and I think it was one of the really area that somehow shown that we can build another hospital, we can have the machines and the equipment, but if you don't have the manpower, that it's really not usable. But also we had this health union package that we negotiated, so it was let's say the lessons learned just partial, because the pandemics continued, but we reflected some of the initiatives or reactions to that for example, EMA adopted some of these special procedures, and I think partly we did, and we are still in the process, and we still be assessing in the future.
Is there anything that you would like to add, Joakim? Because also knowing, let's say, the Nordic focus on the well-being economy, where indeed you have that more holistic approach. And I think Martina made a good point about the importance of health workforce. Is there anything indeed that you see coming back during your presidency?
Well, as I mentioned, we will be quite likely looking back at, for example, preparedness in relation to primarily pharmaceuticals, and I think here there are a lot of connections to the lessons that we learned from, for example, situations with shortages and so on during the pandemic. So that will definitely be taken forward as well.
I have another question about what the Swedish presidency is planning in the area of innovation. And perhaps linking to that, there was another question which I thought was interesting, because it's also very much about the lessons learned from the pandemic, and thinking about indeed potential new instruments at EU level, which probably also will figure under the pharma strategy. So the question was about transferable exclusivity vouchers. And I know there's just been a non-paper presented by quite a group of member states. I believe it was 14 member states that were rather critical, I think, of the transferable exclusivity voucher. So Joakim, the voucher, is there anything that you specifically foresee when it comes to AMR and innovation in that area? And also broader, so Elisabeth Zennen asked, what is the Swedish presidency planning in the area of innovation at large?
Well, to start with the question of the vouchers, I mean, we will first have to see if this features in the Commission proposal, and if it does, I'm sure that will be a discussion in the Council. So then, in that case, I'm sure we will come back to that context, if nothing else. And then, I mean, on the broader side, as I mentioned, we plan to have this featuring a bit in relation to pharmaceuticals, and as well we're planning the life science conference in June, where precision medicine will be primarily topic. So yeah, I think that would also touch on the question of innovation.
I don't know, Martina, if you would like to add anything, because I know that, of course, the non-paper was presented during your presidency. So perhaps either during the official meeting or perhaps behind the scenes, has there been discussion already about indeed what incentives might be needed to tackle the issue of AMR?
Yes, we of course learned about the non-paper, but our official position was that as a presidency we will stay neutral. So it might change from January, but at the moment we didn't join the non-paper. But it was a topic that was addressed during the EPSCO Council as well, where some of the supporters actually mentioned this topic, and called Commission to maybe refrain from as it was suggested. But I think and also Commission said that they are looking for the way forward, and maybe they will somehow amend it and suggest how to what to do in the area, how to support the development of new antibiotics.
Many thanks, Martina. That's important to learn. And as Joakim said, let's indeed see, also in light of the presentation of the pharma package, what the Commission specifically will propose, because of course that will be leading for the discussions then. I see we have another quite interesting and rather political question, and it's about HERA's future. Of course, we're probably all aware of the fact that last week there was this big, I would say, rather festive celebration of the fact that HERA was established a year ago. I think the Commission was very keen to put out indeed that it's important to have competences for the agency, for HERA. It's not an agency, so in that respect, there was a Freudian slip. And discussion indeed, I think, as of the establishment of HERA has been ongoing about, does it need to become a standalone agency? And I think the Commission very much argues that it's good that HERA is part of the Commission, because it means that it's part of the political decisions and the political leadership. However, the question that's being asked is there any discussion foreseen in 2023, so be it by the Swedish presidency or perhaps later in the year, on HERA's future budget and indeed being established as a standalone agency?
Well, maybe not so much on detail on HERA as such, but as I mentioned, when we are planning to look into a bit into the preparedness side, and obviously the creation of HERA is an important context in that discussion. So in that way featured, but perhaps not in that exact detail.
Now, I know, of course, for you, as in your role as incoming presidency, these are quite nasty questions because you may be involved behind the scenes in discussions about it. And I'm sure that perhaps at attaché level and perhaps even at Kuiper level, discussions are underway. But I think probably in public, you cannot comment at this stage, indeed, if it's not part of an official discussion. But I think nevertheless, for us in Brussels, it's an interesting one to watch also when the Commission comes up with an evaluation of HERA to see to what extent indeed anything will change in the future.
And I would just add that we might expect also a role of the Parliament in this. They would like to have a say as well.
Well, that's a very good remark, Martina, because I think the Parliament was unhappy from the start about the way that HERA was set up. So for sure, indeed, we will also hear from them. That's a very good addition indeed. Let me see. We have a few minutes left and we also have a few questions left. We have a question from Tapani Pia. Tapani, it's great to have you as well with us this morning. It's a good question, and I think you have a good eye for detail because Joakim, it also struck me that you use the term precision medicines and rather than personalized medicine. Is there a reason for that? And does that say anything about the focus of the Swedish presidency?
Well, that's what I can say. I mean, the idea here is to that it will be focusing on life science. So that is, of course, in itself a little bit of a broader context also. But I think it will. The idea is that this would focus on aspects connection to precision medicine, such as data-driven implementation, the access of large data, as well as so structures for implementing in care and so on. So I think it's a number of topics in connection to this ethics, and of course then, I mean, this is in the end of June, so I would also say it's a conference that is still under development, so I couldn't sort of go into too much detail of the actual agenda, since I think it's still being elaborated.
Okay, that's interesting, because indeed we have a question as well from Elisabeth Zanen, who asked if the date is already fixed. And I believe you just said the date will be in June, but do we already have a specific date?
Well, I think the idea is by the end of June. I'm not certain if there has been an officially fixed date yet.
Okay, well, I'm sure that at some point on your presidency website, the dates will be confirmed. So Elisabeth and others, I believe we should be following indeed the official announcements there. Then I believe we have a question, and I propose that perhaps these are the last two questions because I'm conscious of time. We have a very specific question about the indicative timeline for decision on the revision of on the MDR. And in terms of the European Health Data Space, this is the same participant, Isabel Johansson, who asked, where are we now in the Council negotiations on the European Health Data Space? And where do we hope to get before the end of the Swedish presidency? So again, the indicative timeline for the revision of MDR and indeed the progress on the European Health Data Space and where we hopefully will land before the end of the Swedish presidency.
Well, on MDR, I think that's a question perhaps more for the Commission when we can see the clear initiatives. But I think we're not talking too far ahead. But it's in any case, I guess the Commission is the right ones to direct that question to. And then on the it was the health data space.
Yes.
Well, as I mentioned, I mean, we are planning to work quite intensely on this file, which is of course also the Czech presidency did. But then also it is a rather large and complex file, so that also perhaps put a bit of a limit to how far you cannot reach. But let's just say that we will try to work as intensely as possible.
Well, many thanks, Joakim. I propose, because we have one question which is very broad about the link between planetary health, the environment, and ensuring that health systems indeed become more resilient. So perhaps the two of you should feel free to use this question as a starting point for your concluding remarks. If there's anything that you would like to sort of say by means of wrapping up this discussion. So again, any observation about, are we now more convinced of the importance of a holistic approach, also including the environment?
Well, I think Sweden is already following this approach for a very long, but in our case, yeah, it was with the AMR is a good example, and we have the EU action plan as well, and I think it's something in our case that we proceed, and of course the consequences in general on and the requirements on the producers to be more friendly, environmentally friendly. So it's something that is promoted, but also in relation with pandemics and with the economic consequences that it will probably take time, but I think it's needed, and we have to do it and try to find some effective ways forward. But as I said, the Czech Republic is very, we had a lot of heavy industry, and it's the impact of the current initiatives is quite strong, and we have to deal with this. So it's very general, probably not too much to health, but also in the health area, I think we still have some potentials that we can explore to be more, and that the cooperation on EU level in this it helps. Definitely.
Absolutely. So Joakim, is there any last remark from your side that you would like to share?
Well, I think that the question of climate and sort of green transition is featuring as one of sort of the major priorities for the presidency as a whole. So that of course goes also for all areas, and I think that the AMR question is, for example, something that is touched by this. So obviously that is something that we are aware of, and that also features. And then, I mean, as I mentioned, on the more sort of broad side on the importance of health, I mean, I think we've seen that we are now working more and more in a range of areas. Just the fact that, as Martina mentioned, we have a health program that is something completely different to what we had before, that also makes it possible to work in a number of areas that was perhaps not possible in the same way as earlier, as well as, you know, the whole health union package, and of course the files that we have on the table. So I think we are touching on a range of issues in related to health in all sorts of areas in health. So let's just say we're doing more in all sorts of health related areas.
Well, many thanks for that, and also for answering all the questions. I still that we see that we still have questions coming in, but we're already over time. So in that respect, I propose that we continue the conversation. But I really would like to thank the two of you very much, Martina and Joakim. It was very interesting and very helpful to hear more about what the Czech Presidency has achieved and what the incoming Swedish Presidency is planning for. And then also that indeed you provided us with the vision on health and what's currently being debated at Council level. I think it's very promising to hear that indeed the EPSCO Council even takes place more often. And that also, I think, recognizes the importance of health for many more areas just beyond public health. So many thanks for being with us this morning. I wish you good luck. I hope for Martina, indeed, that work will be over and that things are perhaps going to slow down. And Joakim, I would like to wish you good luck with your presidency. And we hope to be in touch with you at the European Policy Center. I also would like to thank our participants because, again, you made it a very lively discussions with a lot of different discussions and questions coming in. So many thanks for joining us. And I would like to call on you to keep following us. If you haven't subscribed yet to our newsletter, go to our website and please do so that you also can join us in the future and in the new year. But for today, I would like to thank you very much. Season's greetings, and we hope to stay in touch in 2023. Thank you very much.
Thank you as well for the invitation.
Thank you very much.
Have a nice
Thank you.
Christmas.